Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, and butts. I'm a teacher, an author, and a surgeon. Today we're going to talk about something that I think has really changed, or at least it has in my practice and a lot of my friends that do facelifts, and that is positional sleeping. Okay? For decades, we have told patients after facelift surgery that they need to sleep sitting up. I did 110 lifts last year. I have done over 1,500, and probably the biggest complaint people when they come in the next morning for their 24-hour evaluation is, I didn't sleep a wink last night, okay? And I get it, you know. So when you have surgery, a lot of times you just can't get comfortable. It's hard to sleep. You're on medicines that maybe inhibit your sleeping, and so that's a pretty common thing. However, you try and sleep sitting up, and if you're not used to that, you're probably not going to fall asleep. So several years ago, I just started telling my patients, look, sleep however you want to sleep. I don't care if you sleep flat. I don't care if you sleep on your side. Just sleep how you want to sleep. And this has made a really big difference, because my patients come in, they're sleeping better, they're more refreshed, and they're healing better. And I think there are numerous reasons why you shouldn't sleep sitting up after facelift. One of the reasons is, you know, just the gravity kind of just pulls everything down. And it also gives you a tendency, if you sleep sitting up, to sleep in this position. And the problem is, when you bend your neck, you flex your neck for any lengthy period of time, you make a little roll there that can fill with inflammatory fluid, and it can become a hard roll. And that's why we tell people after facelift surgery, don't stare at your phone for 2 hours in this position. We call that tech neck. But the point is, you don't want to have your neck flexed and have fluid build up under there. So sleeping upright also prevents that. And the lymphatic system, okay, our lymph nodes, these are the organs that take inflammatory inflammation and edema and the fluid from surgery. They take it away from the surgical site. And when you're sitting up, okay, all the fluid is going in the area where you operated, where those lymph nodes are. When you're laying down, that fluid actually goes to the unoperated areas of the head and neck, and the lymphatic drainage is more effective. So really, I think there are a whole bunch of reasons why you should just sleep the way you want to sleep. Now, you know, I think you should all follow your surgeon's advice, but if you come to my office and have a facelift, which I hope you do, I'm going to tell you that after surgery, you go ahead and lie down and sleep that way. Sleep the best way you can, and your recovery will be better. Now, there may be procedures where being elevated a little bit does help. Like for my eyelid patients, I don't mind if they are slightly elevated. They don't need to sleep sitting up. That's just a crazy position, even if they just use 2 pillows. And again, you know, you need to listen to what your doctor says. But for my facelift patients, they're going to sleep flat. My other patients where I'm doing other surgeries on the face, maybe they'll be a little elevated. But again, I think they should just sleep however they can sleep. I'm Dr. Joe Niamtu, LoveThatFace.com.